Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today is Nancy Lessay. She is that's my French version of it, the Director of Education and Training for Senior Resources. That's the agency on aging. And it's been a while since you've been in, so welcome back.
Thank you for inviting me back.
People may not be familiar with the Agency on Aging, Senior Resources, so what is it all about?
Senior Resources does so many programs, and actually we serve a 56-town region. So it makes us the one with the most geographical area to cover.
Oh.
And of course, we can't do it by ourselves.
Right.
We have networks and partners that we serve with, and a whole aging network. We have grantees that provide services for our aging population. We do a great program called Choices, which is instrumental this time of year with open enrollment.
Yeah.
People are calling, they get a free screening. We do not charge for our services, and we have no financial incentive as to what people buy. So we screen them because our job is to make their life better. Our job is to make sure they get the best service and the best benefits that they can.
At some point in the past, somebody must have been sitting around and realized, for our aging population, there aren't enough services available. They have questions. They're not being serviced properly. We need to put something together. How did it come about?
Well, it came about that we're mandated to exist through legislation. That came in 1974. And now the evolution is we're charged with allocating the Older Americans Act funds, which is dedicated for those the federal government says when you're 60, now you're an older American.
Oh. Now, some depending on who you talk to, they may acknowledge that 50 you're a senior,
That's correct.
right?
Even AARP,
Right.
You can become a member at 50. But our job really, and we try to do a good job, for instance, and I'll just speak to this because we're in the thralls of Medicare open enrollment right now. We're aware of a number of programs that dovetail with Medicare. And as you know, Medicare is complex. There's Medicare A, B, C, and D.
Far too many letters.
It is. And they all do different things. Medicare Part A just addresses inpatient hospital stays. Medicare Part B is just that, medical, doctors, physician, lab tests, x-rays, ambulance services, outpatient surgery. Medicare Part D is in its infancy. It happened upon us in 2006, and that's a whole level of complexity, but it addresses prescription drugs only. That's what it does. And Medicare Part C is like a marriage. It's the hospital services married the medical services, and they had a baby, which is Part D, prescription drug coverage, and it's all administered through what we call an Advantage plan, a Medicare Advantage plan. And it's the process is different, but the coverage is as good as Medicare, if not better, but it's a different process, and if that process doesn't work for you, it's certified by county, and there's a list of providers. So if your doctors are not in that list of providers, then it's a good chance that Medicare Advantage plan is not good for you.
You hear a lot in commercials, because it's to their benefit, that they let you know that Medicare usually only covers like 80% of certain things.
That's correct.
So
for
supplemental
Part B services,
plans,
you're absolutely right. And typically with the supplemental plans, that's meant to supplement what Medicare approves. So if Medicare approves the service, the supplemental plans would pick up the 20% co-pays. It would pick up the deductibles, and they're different for Part A and Part B and administered differently too. The thing that folks get, I want to say, confused about is, for instance, dental services are not covered with Medicare. So if they go to a dental provider and say, well, bill Medicare, because even if Medicare won't pay, my supplemental will, that's incorrect. So what a Medicare supplement is made to do that, to fill the gaps of Medicare, and services like I want to say routine foot care, hearing aids, eyeglasses is not covered through Medicare unless it's connected with cataract surgery. Then you get corrective lenses.
So just like regular insurance, usually you would have to have separate dental and vision.
That's correct.
So with Medicare, you would still need some kind of separate dental or vision, and in this case, it would be that supplemental insurance.
With an additional premium.
Right.
With the managed care plans, oftentimes they have dental product for like $18 more a month, something like that. And there's one supplemental plan F that Humana operates.
I see their commercials.
Yeah, they have a dental rider that you can purchase for a separate premium. But I don't want folks to get confused.
Yes.
Dental is not covered by Medicare.
All right. And the most important thing is the main Medicare first. We can get into all the other extra stuff too, but be insured. And as you mentioned, and this is not just Medicare, but everybody's in their open enrollment period now, right?
Absolutely. The only folks that are excluded from that are like people new coming on to Medicare, because they have 3 months before, the month of, and 3 months after to enroll in Medicare, especially Part B. Usually Part A, folks get simply by turning age 65, and even if they're working, there's usually no premium associated with Part A, because if you work 40 Social Security work quarters, then you don't have a Part A premium. So a lot of folks that are still working, turning 65, they get Part A of Medicare, go to the Social Security office or enroll online, but they delay Part B, and they should if they're already covered by credible coverage, whether it be that of their own employment or that of a spouse.
Let me ask you this question for the future. If you could look into the future, you know how people are concerned that maybe Social Security may not be available depending on how far down the road you go. What is the future for Medicare?
Medicare, I want to say, it's excellent. It runs well, but it is expensive.
Yeah.
So a lot of times what
Expensive
happens...
for who? The taxpayer or the person that has the Medicare?
Actually, the trend is the cost is being shifted more and more on Medicare beneficiaries. In this way, they increase the deductibles, they increase the premium. And supplemental insurances, although it supplements Medicare, are very expensive as well.
Yeah.
And then you have the co-pays for Part D. You have a premium, and then you have co-pays with that too. So cost shares for Medicare beneficiaries is going to go up.
I want to talk a little bit more about the what you call the extra help to
Yes.
assist in the cost of drugs, because it's one thing to be supplemental to your regular, Medicare
Medical
insurance,
package,
but
yeah.
specifically about prescriptions.
Well, this is, I want to say, the best kept secret. It's called the Medicare Savings Program, and it does two very, very important things. There's 3 levels of benefits, and instead of getting into all the detail about the income guidelines, we're going to talk what the levels are. The first level is QMB, and that stands for Qualified Medicare Beneficiary. And what that does is it acts as a Medicare supplemental to Medicare. It picks up the Part A deductible, the Part B deductible, the 20% copays. It also picks up the skilled nursing facility copay if a Medicare beneficiary was in the skilled nursing facility from day 21 to day 100, it would pay that, because Medicare only pays 20 days. That is excellent to have. However, the second benefit is it opens the door to Social Security to provide that extra help. It's called LIS, Low Income Subsidy.
Sounds like that is one of the best
And
kept secrets.
it is,
Yeah.
because what that will do in 2016, it will limit your copays for generic drugs to $2.95, and if you're on a brand name, $7.40. That's all you're going to pay as a copay versus 25% of the cost of the drug. In some cases, it will pick up all of your Part D premium or a portion of it. So it opens the door to extra help in that we talked about the Cadillac of the line, the QMB, but there's 2 other levels, SLMB and ALMB. That pays your Part B premium only, but it still opens the door for that extra help through the federal government, the Social Security office.
Now, those are the levels, and if you
Yes.
wanted to dig deeper, you would get into the income act, how that factors
Piece of
into
it.
it too.
And
Gosh, it's so
It
complicated.
is, but
you know?
what the government did and they got it right.
Did they? What? I've never heard that before. Are you telling me? Is this real?
The application for the Medicare Savings Program is straightforward and easy to fill out. It's amazing. Typically, a Medicaid application is between 21 and 23 pages long. This is
Now, Medicaid is based as
2
income
pages.
based, right? Okay.
Yes. This is 2 pages. And the nice thing is they list what they want you to tell them about your income, your Social Security. And these are gross amounts, not net after that Part B premium
Yeah.
is taken out. If you have a pension, if you have interest on assets, so it's not asset tested, so they don't care about your home, your car.
Okay.
If you had $1 million in the bank, the $2 interest you would get is counted.
Okay.
So interest is counted, but not the asset itself.
So not the $1 million?
Not the $1 million,
Wow.
because that's an
so
asset.
I can pull my money out of the Cayman Islands when I get a little older?
Yes, you can,
Wow.
Sean.
Okay.
And there is no recovery. Typically, when you're looking at Medicaid money, there's a recovery when the estate is probated, the lien on your house or something like that. The state gets their money back, and in some programs, like the Connecticut Home Care Program, the recovery is alive and well, but not with this program. However, with this program, it's either you're in or you're out. There's no spend down, there's no providing 5 years of bank records and all that stuff. You don't have to give away your firstborn. You're pretty safe with this.
Wow.
So it's a great program.
All right. Well, this is a great opportunity for us to take a break. I'm going to have you give the website out for people to go and learn more. Then we'll come back and chat. What is the website?
The website is www.seniorresources.org.
Nancy Lissay, Director of Education and Training for Senior Resources, the Agency on Aging. We'll take a short break and come back. I'm Sean Murphy. This is For the Record. Stay with us. Welcome back to For the Record. I'm Sean Murphy. My guest is Nancy Lissay, the Director of Education and Training for Senior Resources, the Agency on Aging, and we are certainly getting an education today. You make it sound, so I almost looking forward to getting older because
And
you
you
make it seem,
should.
and make it seem so easy. But it sounds to me like, I don't know if I remember from the last time you were on, which was a couple of years ago, things have gotten more streamlined, easier a little bit.
I want to say things are easy when you know the process.
Okay.
When you don't know the process, then it becomes complex and difficult. But that's why we have a willing staff that not only does and performs because we get paid for it, but we want to help people. And I'll just give you an example. Just in this open enrollment in 2016, there are now 23 plans to choose from.
Is that
So-
just for a
Just
drug?
for prescription drugs.
Wow.
23. In 2006, there were 63 plans. So you can see how the trend is. Now
Right.
there's 23.
Is that a good thing that is coming down? Is
I
it
think
lack of
it's-
choices or is it?
I don't think it's lack of choices. There's 300 formularies floating around, probably even more now. Not all 300 formularies are in Connecticut. So folks ask the same question, what's the best plan for me? Well, the best plan for anybody is the plan that covers your unique prescription drug need, because it's usually for chronic conditions,
Yeah.
high blood pressure, cholesterol, things like that. So this is how we orchestrate this. We go on the site, www.medicare.org, plug in the zip code, plug in the correct spelling of the prescription drug, how many milligrams it is, and how many times you take it a day. So that's important because sometimes you're looking at a 30-pill script or 60 or 90 or 120, depending on how many times you take it. Actually, once we do that, what comes up in order of which is the most economical plan doesn't make it the plan for you because there's roadblocks. One of them is step therapy, and that's a nice way of saying, we're not going to pay for this, you're going to try this other drug for 90 days, and if that doesn't work, you're going to try something else for 90 days.
So the insurance company dictates what drug you take? I mean, I can
Step
understand
therapy.
generic versus brand.
Yeah, and there's that too,
Yeah.
and there's different tiers of generics.
Well, God,
So,
goodness. Oh, wow.
Yeah, it's complicated.
What a tangled web.
Yes, that we didn't weave.
Yeah, that's right.
And along with that, there's prior authorization, which means your doctor now's got to do a little paper fill out and advocate for you to get that. And the one that is most common is quantity limits. The company might set a quantity limit of 60 pills. And if you're only taking like 30 a month, then you're pretty much in shape. And if
Yeah.
your prescription goes up to, twice a day, then you're still covered.
Right.
So we look at all that as well and explain to the people that we serve.
It never should be the dollar being the bottom line, whatever's the cheapest, because there
No.
are so many factors in there.
Right, and we want people to be able to access their medication with the least, problems. Another thing that is hard to manage is this year in 2016, there's a $360 deductible first on some of the plans,
A
not
year.
all of them.
A year.
Yes,
Oh,
nice
boy.
way of saying
Yeah.
you pay out 360 and then we'll take over. But when we talked about that extra help that the Medicare Savings Program opens the door, or you could go and apply at the Social Security office as well. However, there is an income and an asset limit if you go directly to the Social Security office. There's an income limit, but no asset limit. That's important to know.
Oh, yeah. So your house is an asset, but it's not subject to what you were talking about. Yeah.
Exactly. And because assets are treated differently, usually the home you live in is not an asset, and one car
Right.
is not an asset. But if you have, a retirement package or IRAs or an annuity, that could be construed as an asset for some programs, not this one, just the interest. But that extra help would pick up that $360 deductible.
And for some people, that's a big deal.
That is a big deal.
Yeah.
I work full time. If I
Yeah.
had to pay $360, for a deductible, I'd be a little worried. And typically, we're dealing with a population that is living on a fixed income.
What is the population, the aging population of Connecticut? What is its current state now?
Its current, I'm trying to think of, I think we have 81,000 people that are Medicare beneficiaries. So that's, I believe, in our 56-town region.
Okay.
I'm not even sure what it is statewide.
Yeah, in the rest of the
Because
state.
there are those that are Medicare eligible due to age, and then there's a disabled population
Yeah.
that is on Medicare as well. So that's important to know.
Let's talk about benefits, checkup, all that
Yes.
stuff too, because that's really important too.
It is important. This little program does so much in so many ways. It's like a screening, and it saves gobs of time for applying for programs you're never going to get anyway because you don't qualify. So actually, you go in the database, you plug in the zip code, there's, I want to say, a set of about 20 questions that you answer. Then what magically prints out is all the programs you fall in the parameter of receipt. You've not applied for anything, so now you have to go through the application process. But it's a nice guide to have because if you're looking for the Medicare Savings Program, for instance, that will give you the description of the program. There's a way to access the application, and it gives you where to send the application. Once you fill out this application, send it to whatever. And we help with the application assistance. A big program that is popular is the Charter Oak program, where folks can go to any state park and not have to pay the parking fee. And if they're in the car, the whole group gets
Yeah.
that. So
Who's ever
no
in
one
the car.
has to pay.
Right.
So that's nice. Just nice programs that add quality of life for, individuals.
And I bet you a lot of people aren't even aware of a lot of those programs too.
They're not. They're not aware of it. So when they come to the agency, it's like a one-stop shop. This is on our website, but anybody can plug in www.benefitscheckup.org and actually do it themselves. So if they just wanted, maybe do it for a parent, they can go on our website and access it, or just do it on the internet, and it doesn't go anywhere. It doesn't go to the IRS. It doesn't go to...
Stays confidential,
Exactly.
right? Yeah.
Exactly.
Now, there are probably some older individuals that aren't very comfortable necessarily with online or technology in general, so you can help with that too, right?
Absolutely.
The people that don't even have a computer, they just don't, you don't want, they
It's
don't feel like
scary.
teaching an old dog new tricks, and they just don't want any part of it, and you know, you can't blame them.
And they can come right to our office, and they can sit with us, and we can print it out. If they want us to send it to their maybe son or daughter, we could do that too. But nothing replaces that face-to-face contact where people not only come to you, they get to know you and trust you.
You wouldn't know that with the kids today on their phones. They would rather, you know, text somebody than actually
Oh,
talk to somebody
absolutely.
in person, you know?
It's a different
Yeah.
generation,
Yeah.
and they're comfortable with different, and they can talk the lingo. A lot of my clients, it's not unusual for us at Senior Resources to have had the same clients for over 20 years.
Yeah.
So,
And they rely on you. The people should know that for your purposes, you serve a certain segment of Connecticut. But if somebody's watching in a different part of the state that you don't personally service, you can certainly steer them to the right location.
absolutely. And the beautiful thing is with our Choices program, we have a dedicated 800 number. Wherever you are in the state, you're going to get the area agency that serves you. So if someone from Hartford called the 800 number, that would go directly to the Hartford Area Agency. We're fortunate because we have such a big geographical location that it used to be a toll call if someone
Yeah.
from Middletown called us.
That's right.
So we have our own dedicated 800 number, and oftentimes when people call, even if they're not in our area, we typically know, which agency they should, or we'll just help them ourselves if we can.
What is the biggest concern that people have when they call? What do they most worry about that they need help with?
Out of 80%, out of all the calls that we get, and we field about 800 calls in a 3-month period. So that's a lot of calls. The overwhelming majority are calling about an issue dealing with Medicare, whether it be a denial, it could be, is this covered? It could be my diabetic supplies, where do I go to get that? Because the complexity, again, some things are covered under Part B of Medicare, and other things are covered under Part D. And one of the more confusing things is Part B services are usually, something is covered if it's an incident to a physician's visit. Like, let's say you were ill and you got an antibiotic, and the doctor at the time, gives you a shot. That's covered under Part B because it's incident to a physician's visit. But now, take like the pneumonia shots or shingles. Shingles, for instance, oftentimes you have to go to the pharmacy because it's covered under Part D with the script. They give you the script because it's something that's got to be refrigerated and this and that. Then you go to your doctor and get the actual shot. A lot of folks don't know that. And if you're, again, in a managed care plan versus traditional Medicare, that process may change.
I keep seeing people with shingles. That is just not pleasant at all.
Oh, my word.
It's
And-
just avoid it if you can.
Really.
And
And-
unfortunately, like 1 in 3 people, if you've had chicken pox, that virus is in you no matter what.
And it can come out at any time. That is scary. I'm happy I never had chicken
Yeah,
pox.
yeah. Oh, you never did? Oh, wow. So we are just about out of time. Let me take one more break and come right back, and we'll wrap up the show and get to a couple other things. I'm Sean Murphy. This is For the Record. Stay right there. So that is just about our show for today. For those that are watching in Rhode Island, they have one agency in Rhode Island,
Yes,
correct?
they do. The Department of Elder Affairs. It's a one-stop shop there. They do what I talked about the Choices program, helping people with Medicare. They have the exact same program. They have a senior Medicare patrol. Most of all, a benefits checkup.
And that's huge.
That is huge because you could even screen for Part D using the benefits checkup. So there's just so many things. It's housing, energy bills, tax assistance.
Right, there's so much stuff that we didn't even get to
I
today,
know.
but we hit the important stuff. Talked about Medicare a lot. By the way, are people if they miss out on the open enrollment, are they kind of stuck until the next open
Yes,
enrollment?
yes.
All right, so
And
they should
it's-
make sure they get to it.
And it's always good to do a screening, even if things are running well. It's always good to get a screening because maybe there's a better, cheaper plan out there for them that will cover their meds with less cost, and maybe there isn't. Maybe they should just stay where they are. If you're happy and you know it, keep your plan.
Nancy Lassay, the Director of Education and Training for Senior Resources, the Agency on Aging. We learned a lot, and we thank you for being back on the show.
Thank you.
That is our show for today. You can see this show as well as many others on our YouTube site. Till next time, I'm Sean Murphy. This is For the Record. Take care.